Hi, I'm Kirsten. I'm sure that you or someone you know has heard of a total hip replacement, also known as a THR. For those of you that don't know what a total hip surgery is, it's easy to understand. A total hip surgery is a surgical procedure where the bones of the hip are removed and then replaced with various materials such as metal, ceramic, or plastic parts. These new parts form the upper end of the thigh bone and resurface the hip socket in the pelvic bone. In other words, a total hip replacement replaces what is known as the ball and socket joint of the hip. There are several reasons why someone may need to get a total hip replacement. Arthritis is one of the most common reasons. Other reasons include bone cancer, hip fractures, developmental dysplasia of the hip, which is when someone is born with a dislocation or instability of the hip. A vascular necrosis, which is a condition where the top of the thigh bone loses blood supply and dies, or severe trauma. Hip replacement surgery is an option if pain interferes with daily activities and other treatments have not helped. This artificial joint helps reduce pain, increase mobility, improve activities of daily living, and quality of life. Recovery time for a total hip replacement is approximately 4 to 6 weeks. This is usually the time it takes for a patient to walk without a walker and without pain. The time it takes for a patient to return to work and activities of daily living varies depending on age, lifestyle, and their prior level of functioning. Typically, a patient can return to their normal activities within 1 to 6 months. The prognosis for a total joint replacement is one of the most successful joint surgeries performed today. For patients who are appropriate candidates for total hip replacements, the procedure can last up to 15 years in nearly 95% of patients. Long-term results are constantly improving with new technologies and devices which will further the success of total hip replacements in the future. Additionally, prognosis is good when the patient includes occupational therapy to return to their activities of daily living. An occupational therapist teaches the hip precautions that are vital for the patient to know so that they don't accidentally dislocate their hip after surgery. They also educate the patient to dress independently using adaptive equipment while adhering to their hip precautions. In addition to helping a patient in the rehabilitation process, occupational therapy teaches energy conservation techniques. These techniques allow a patient to complete activities of daily living while they are recovering from surgery. In the following video, you will see a demonstration of an occupational therapist that is helping a patient after a total hip replacement, and you will notice just how important and helpful occupational therapy is in recovering from surgery.
Hi, my name's Joanna. I'm an occupational therapy assistant. I'm just about to go in and see a patient whose status post day 0 after a total hip replacement. She's 45 years old and she fractured her hip from a fall. So we're going to go in and do some education on precautions and then maybe address some lower body dressing using a reach or other adaptive equipment. Alright, let's go in. Hi there. Hi Erica, isn't it?
Yes.
Yeah, nice to meet you. My name's Joanna.
Hi,
I'm your
Joanna.
occupational therapist for today.
Hi.
And I hear that you've just had surgery for
Yes.
a total hip replacement. Okay, and everything went really well, the doctor said. How's your pain levels right now?
It's about a 3. It's not too bad.
Okay, and have you had some medication for it recently?
Yeah, about 20 minutes ago.
Oh, perfect.
Yeah.
Okay, so that's a really good time to start therapy. If your pain's under control, you're feeling comfortable, and you've seen the nurse. So the aim today is to kind of get you edge of bed,
Okay.
introduce you to some adaptive equipment to help you with dressing.
Okay.
But first of all, it's very important that we go over 3 hip precautions with
Okay.
you. I know your doctor said that he went over some with you before surgery, but it's been a really long day.
Yeah.
So do you remember any of them that he...
I think I remember him saying that I'm not supposed to cross my legs, which is why he has me like
Perfect.
that.
Yeah, that's one of them. So there's 3. The first one is bearing in mind the edge of your trunk and your hip flexion. So when you bend your knee here, the amount that your hip flexes
Okay.
should not be greater than 90 degrees. So
Okay.
if you see this angle here,
Mhm.
so it's really important to adhere to that during bending over to pick things up. So bending like this, for dressing, for stepping into the shower, things like that. So what I'm going to introduce you to is using a reacher so that you don't have to do that bending motion, because all of these 3 precautions should be adhered to for 6 weeks.
Okay.
Okay?
That's a long time.
It
for
is.
bending.
It is. That's why we try and introduce you to some things to help you in the meantime, so you
Okay.
can be independent and not rely on other people. And then after the precaution period is over, obviously then you'll be able to be bending over and
Okay.
things after you've spoken to your doctor about that.
Okay.
Okay? And don't worry, you won't have to remember them all without any help. I've got a little worksheet or like a printout for you to explain them all, so we can put them right next to your bed. So if you ever forget and
Okay.
you're worried, then you can read through it there.
That'll be helpful. Thank you.
Okay. So the second one would be, like you said, not crossing your legs.
Okay.
So if you look at the angle of my hips and
Mhm.
my feet, if you can see them.
Mhm.
So if you cross over your legs at the ankle, then you're still bringing your hips in.
Okay.
So this is the motion that you don't want to be doing. Okay. So that counts for if you're lying in bed, there's no crossing your ankles, crossing your knees,
Okay.
sitting in the chair, things like that. You just have to not cross over the midline. So imagine there's a line down your body.
Okay.
You don't want your legs to be crossed over that line.
Got it.
Okay. The third one is not bringing your toes inwards,
Okay.
because as your legs are all connected, so if whatever your feet are doing, your hips are also doing. So
Okay.
if your feet are pigeoned in like this, it means your hips are also twisting.
Okay.
The same goes for twisting at the waist. So if I were to do this, it's still causing my hips to twist. So that's another precaution to adhere to. But don't worry,
Okay,
we'll
that's a lot.
I'll help you and demonstrate again, and then go over them at the end to make sure that you remember those 3.
Okay.
So no hip flexion past 90, okay? No crossing your legs, and no pointing your toes inwards. So
Okay.
keep your toes straight and your toes outwards.
Okay.
So also another thing to help you with your hip flexion, when you're sitting in the chair, try not to sit on a chair that's too soft or might cause you to sink into it to bring your knees up. You want to keep your hips higher than your knees.
Okay.
So sitting on a pillow, something like that, will help a lot. Or sitting on the edge of the bed with your feet over the edge where the bed's a bit higher. Make sure that it's not lowered too much. That will mean that you adhere to all your precautions.
Okay. I'm glad I have a handout.
I know, it might sound a bit overwhelming at first, but I'm sure you'll be fine, and we're all here to go over it with you again if you need
Thank
to.
you.
Okay, so we've gone over the 3 precautions. The next thing we're going to do is get you edge of bed, and
Okay.
then we're going to help you don on some pants and using a reacher.
Okay.
So let's take off this pillow for you.
Okay.
Okay. And your left side is operated. So. Are you feeling any dizziness or anything
No.
in bed? Okay, so
No.
we're just going to keep an eye on that as we move you
Okay.
to the edge of the bed. You've had your vitals checked and they all look fabulous.
Great.
Okay.
Yeah, other than the pain in my hip,
Mhm.
I'm feeling okay. So.
Great. Okay, so this is how we're going to do it. I'm going to help you move your operated leg towards the edge of the bed in steps. And as I do one movement. If you could bring your unoperated leg closer,
Okay.
and as you start to swivel, if you can use your hands behind you so that your trunk kind of swivels around at the same time.
Okay.
Okay?
Okay.
So, there we go. Bring that one. Perfect. And again.
Okay.
Very good. Okay, and then if you can scoot closer to the edge of the bed. Perfect. And adhering to your precautions. Perfect.
Yeah.
Okay, so no, your pain's okay still,
It's
no
okay.
dizziness.
Yeah.
Just
it's a
remember
little
to
painful,
breathe. Breathe deeply. Okay.
but- Yes.
So your husband brought in these for us,
Okay.
which he said you kind of loaf around the house in, but I'm sure you'll be doing that for a couple of days when you get home anyhow.
Those
So
are my
they're,
favorite pants.
they're perfect to practice with. They're nice and easy. So when you're thinking of getting dressed in the first couple of weeks, you might want to think about the easiest things to get on up and down your legs, whilst adhering to your precaution of not bending.
Okay.
So I'm going to put those on the floor for you, and then we have a reacher here. Have you ever used one of these before?
No, I haven't, but I've seen them.
Okay. So you just grip this in your hand
Okay.
and use this as a kind of trigger to operate this end.
Okay.
And then with the lever on this end, you pick up the edge of your pants and you can bring it, slide it over your foot and bring it up until it's in your hand
Okay.
without you having to bend over.
All right.
So let's try that. So, using the lever at the end, grip it and slide it over your foot without bending your leg. Perfect. Don't worry if you don't get it first time, that's why we're here, we can practice.
Yeah, it's gonna take some practice, but
There you go, grabbing the elastic part up to your hand. That's fine.
yeah, this is harder than it looks. There we go.
There you go.
Okay. So now I can just put this leg
Yeah,
in, right?
that leg has no precautions, that
Okay.
hip. So you can bend that one
Okay.
to bring it up. And then pull them up. Okay, now how are you feeling about standing right now? I have a walker here that we can use to support you so that you can pull your pants up.
I
Okay?
think I can handle it.
Alright, so we're going to put this one here.
Okay.
And what you're going to need to do is use your upper body strength to support your weight to start with.
Okay.
And obviously not flexing this knee. So you want to bring your foot back towards the bed, perfect, and try and keep it flat on the floor.
Okay.
And then you're going to push up your weight on this leg and your hands. So put your hand up here and the other one. And then leaning forward but keeping this, your operated leg straight,
Okay.
and using this leg to push up. And keep your weight in your arms, perfect. How are you feeling?
It's a little painful,
Yeah,
but it's okay.
probably feels a little bit strange and
Yes.
getting used to the weight bearing. So it's weight bearing is tolerated. So as long as you can tolerate the pain and the kind of discomfort, that will ease as time goes on.
Okay.
So the walker will help you obviously, and then if you keep your weight supported with one hand, and you can finish putting on your trousers. Okay, perfect. Alright, so what we're going to do now is use the reacher to take off your trousers and then get you back into bed.
Okay.
Okay? So making sure that you bear your weight on one of your hands. You can use kind of your hands to scooch your trousers down past your bottom.
Okay.
And then before you go back onto the bed, you want to make sure that you can feel the back of the bed behind your knees so that
Okay.
you know it's there and it's safe. And then put one hand behind you to support your weight and keep the other on the walker until you feel like secure to sit down.
This hand?
Mm-hmm. Okay. Very good. And not too much hip flexion either, which is great. And then you can use your reacher to take the trousers off your unoperated side, that's right. Do that one first.
I can.
And you can flex this
Okay.
knee and hip, no problem. So you can bring it up towards you and use your arms if that's easier, or use the reacher to kind of push them off. There you go.
Okay.
And you can also use this other foot as well to kind of help you a little bit, as long as you don't cross over the midline. That's fine, perfect. All right, so I'll keep this one right here so we can do another practice again tomorrow.
Okay.
And then to get you back into bed, we just reverse what we did to get you into bed. So we want you to kind of scoot your bottom back into the middle-ish of the bed. Okay, so we're coming to the end of our treatment session. Did really well today. And I wondered how you were feeling about the precautions that we went through at the beginning.
I think I got them now.
Yeah. Do you feel like you could recount them for me?
Yes. The first one is no bending over 90 degrees.
Mm-hmm.
And then the second one was no crossing my legs.
Yep.
And then the third one is don't turn my toes in towards each other.
Yeah. Very good. Okay, so I have a handout, I promised you,
Okay.
that just goes over those and gives you some alternative ways of being able to adhere to those precautions, like using the reacher and things like that that we practiced today. And also it goes over the different ways that you could accidentally go against those precautions. So like with dressing and things like that, and how the bending could be, you could break the precaution through like lifting your leg up too high. It's just some information for you that you can keep by your bed.
Okay.
Okay.
So I might forget.
Okay, you did really well, and I'll see you tomorrow for some more OT.
Okay, thank you.
Okay.